All right. Hi, everyone. Thank you for joining us. My name is Stephen. As part of Asian Focus, we would like to welcome Dr. Christopher Leo. If you could just introduce yourself, let's get started.
Good evening, everyone. My name is Christopher Leo. I had my residency training in the New York Montefiore Mount Vernon Hospital, and then I finished my fellowship in geriatrics in the Duke University Hospital. Right now, I'm working for the Duke and as a internal medicine attending. Um, before we start, I wanna thank Asian Focus to give me the chance to present. This is a very popular topic. How do older people remain healthy? I'm going to start with three subtopics. The first one, I'm going to introduce geriatrics in the United States. The second one, I'm going to talk about how older people remain healthy. And then next one, there's several very common health problems. We are going to talk about how we can do or how we should do at home to improve the problem without any doctor's advice. So the first one, so geriatrics, this is a kind of a medic thing regarding the healthcare for the people with age over 65. And so basically the geriatrics is based on the internal medicine. We are able to provide healthcare for the older people to treat or handle their health issue. At the same time, we may pay more attention on their function status, on the social support. So currently in the United States, there are about 7,000 geriatricians in practice. So usually we can see the patient in the office. We can come to their house and then to check, to talk, and to examine them. And also we see the patient in the greenhouse. And some geriatrician can work as medical director to cover the nursing home, cover the rehabilitation facilities, and also we can do the job as like a primary care attending in the hospital or do the consult in the hospital for the inpatient service. So
Before you
compared
continue,
to, yes,
do you have slides up, or
can
are
you say that
you
again?
are you sharing your screen, or
Oh yeah, I'm not sharing. Oh my
not
God.
anymore? It's okay.
Sorry about that. How about
Thank
now?
you.
How
Thank you.
about now?
Yes, we can see it now.
Okay, very good. I'm so sorry. Um, so yeah, we're talking about the support. So basically, compared to other medical specialties, geriatrics is kind of a very special because we are going to take care of the older people at the same time we take care of their caregivers because we believe their caregiver, if the caregiver is in good shape physically or mentally, they may provide very high quality of care for the older people. So that's why geriatrician is very easily to make a friends with the whole family, with the older people and their caregivers. So this is the very basic introduction regarding the geriatrics in the United States. Next one, how older people remain healthy. So I want to talk about what kind of a diet we recommend and what kind of shoes we recommend. Also, we're talking about how we can modify our living environments and how to do exercise. Um, so the first one, so everyone knows basically the Asian people take higher salt intake than other people. So on average, we take about like a 10 gram a day of sodium. But other people just on average, they only take a 4, maybe 5 gram salt a day. So just based on the data published in the New England Journal of Medicine, the high salt diet increased the risk for the heart problem, like a heart failure and a stroke. So which is not good. That's why we always recommend low salt diet. So, but how low the salt diet should be is less than 2 grams. So that means basically we don't recommend you add any additional salt in your food. You just cook it. And if you don't think this is not taste, if you don't think this is tasty without adding salt, you can try some spicy sauce. So just remember low salt diet. And another thing I want to say is diet modification always can be a type of a therapy. For example, if you have a diabetes, we recommend a low sugar diet. If you have a hypertension, we recommend DASH diet. So that means like very balanced diet, where we're talking about this later. And if you have a high cholesterol level, we recommend low fat, low cholesterol diet. So the diet is kind of like a type of therapy. And next one, we're going to say balanced diet. What does that mean? That means basically we want you eat different types of food, like a vegetable, a little bit nuts, a little bit protein, and a little bit like a white meat, something like that. So just make your diet very balanced. You don't want to just focus on one diet, kind of like a rice all the time, or I like noodle, I just eat a noodle without others. So just remember balanced diet. And the DASH diet is kind of a very popular diet in the past 20 years. You can Google online, so just say, hey, DASH diet. It's basically, it is like a types of a balanced diet. And it is very good for the high blood pressure control. And another question about the diet is, people always wonder if should we lose weight or should we gain weight? So the answer will be case by case, because the ideal body mass index, we call it the BMI, will be 27 to 29 for older people. Why? Because the people with the BMI in this range may have a longer expectancy of life than other people. So I just put a formula here to tell people how to calculate the BMI. So this is diet. Next one, we're going to talk about how to choose shoes. Why? Because the fall is very, very common for the older people. And then that caused a lot of questions. I see a lot of people came to the hospital after a fall, and then they had a bone fracture, they have a severe pain, they cannot move, and then they lay in bed for a long time, cannot sleep well, then they develop a constipation, depression, social isolation, and then the function just keep declining, and several months later, they may die from the fall. So we try to do everything to prevent the falls. So the first one, or the most important one, is try to choose a perfect shoes. And the first one, we want to say, hey, you want to choose a sleep resistant shoes, and then that fit your feet very well. And also you want to choose breathable, warm shoes to keep your feet dry and warm. And it should be easy to wear, right? You don't want to take a long time, just wear a shoes. It doesn't make any sense. And also you want the shoes will be very comfortable, right? And we're not recommend a flip flop, because it's very easy to fall if you're step on that. And a lot of older people just leave it alone. So leaving alone is kind of a problem. If you fall, it's hard to say help, or it's hard to call some like 911, because you never know what happened after the fall or came from the fall. So we would recommend, if you live alone, just have a life alert. Next one, living environments, very important, because we want the people have a low risk of a fall, and then at the same time, we want the people may have a good sleep at night. And so first one, we're talking about bedroom. So in the bedroom, we want to just try to have only necessary furniture, and then you don't feel like very crowded, and then you may have a lower risk of a fall. At the same time, we want you have a light which is adjustable, and then when you want to sleep, you sleep. When you want to wake up, you have enough light, and they give you like very bright light, and then you can see everything. And also we want you have a window in your bedroom. And next one, the bed and the chair, how high it should be. So I put a picture here. You can see that the perfect height of a bed or chair should be when you sit on there, your leg, the angle between your leg and thigh should be 90 degrees. So like the one in the middle. So that would be perfect height for the bed and chair. So when you decide to buy a new bed or new chair, you just measure it and then try to and then decide. And so how about living room? Still less furniture. The less furniture, the better the living room. And we want you have more space for activities. And then we also want you have enough light, and then you can see everything to prevent falls. And the stairs, we want everywhere when you step up or when you step down, you may have a handrail, and then you can hold it. And also there should be, there's like a slip stopper like this, or used to prevent falls. And the bedroom, sometimes we do recommend handles, or sometimes you may need a bath chair. It really depends on how independent you are, but the handle is very necessary. If you can have it, you try to have it. So next one, we're going to talk about exercise. So how do older people do exercise? What kind of exercise we recommend? There's a geriatrician. So here we were talking about like a physical exercise and a mental exercise, or you can say brain exercise. So physical exercise, I recommend walking. Why? Because it's a safe. You may have enough time to respond, to see, to adjust when you are walking, right? If you are running, sometimes the older people cannot respond to any like a very urgent event. So walking, but if you can run, you run for sure. But sometimes not every older people can run. So try to walk. And housework. So housework is very important. So if you can do housework, you do it. Just keep the function. It is very important for older people. Jogging, we're just running. We just talk about that. If you can run, you can jog, you just do. Hiking, it really depends. A lot of people may have a knee pain, right? A lot of people have like a muscle weakness. So we are not going to recommend hiking for them. So just case by case. If you want to do more and then you can tolerate, you just do more. And the ideal exercise intensity will be 150 minutes per week. So you can do it like a 30 minutes a day, 5 days a week. That would be great. And also next one, we're talking about a brain exercise. So basically walking is kind of a brain exercise because your brain will just coordinate everything. Your arm, your eyes, your legs, your balance, your breathing. So it's kind of an exercise for your brain. Also entertainment, like listening to the music, watching TV, talking to your friends, and playing chess or anything like that. That's brain exercise. So the mental exercise may help prevent dementia, or at least slow down dementia progress. So very important, very important. So Next one, we can talk about the most common disease in older people. At least several things here. Because those things we can do something at home without doctor advice. For example, hypertension, that means high blood pressure. Next one, insomnia, that means the difficulty sleeping. Next one, malnutrition or like a muscle weakness. And then constipation. The last one we're gonna talk about like a urine incontinence, or for male, for male it would be like a BPH. That means weak urine flow. So hypertension. So this is like a little bit different between the young people and the older people. So for older people, we may consider the normal blood pressure will be like a 130s to 150s, over 60s to 80s if there's no symptoms. But usually for the younger people, we wanted the blood pressure lower than 120 over 80 or 90. So that's the goal will be the difference. So why? Because a lot of older people, if you have like a blood pressure 120 over like 60, 70s, they may have a dizziness, especially when they're standing up from a sitting position. They may feel dizzy and then cause fall. So that's why we wanted the people, older people have a little bit higher blood pressure. And so several things we can control the blood pressure, right? For example, your blood pressure is like a 160s, 170s, but there's no other symptom, no pain. So the first one we can do is like a DASH diet. We do like a diet modification. We try to eat low salt. We try to do some exercise, and we try to have a regular life rhythm. For example, like I go to bed around 9 p.m. and then wake up around 4, maybe 3 a.m. That's okay. If you feel okay, you just do it every day. So go to bed at a certain time and just wake up at a certain time. That's fine. It's good for your health. Exercise, yes, very important, very important. Even you can do it twice a week. That's much better than 0 a week. But be very careful about the beta blocker. That's kind of a medication for the blood pressure control. So at least 3 beta blockers here: metoprolol, carvedilol, Tylenol. So why? Because those beta blocker can lower the blood pressure, at the same time can lower the heart rate. And when you stand up, when your brain needs more blood supply, your heart cannot work because there's a beta blocker, and just let your heart calm down, and then your brain will feel dizzy and then fall. So be very careful about the beta blocker. So when we start beta blocker, we have to monitor you very closely, and you'd better just see your doctor maybe once a week in the first several weeks, or maybe, and then if you're stable, there's no other symptoms, you can go from there. All right. Next one, insomnia. So that means difficulty sleeping. So difficulty sleeping, there's a lot of reasons. For example, the people may have irregular sleep, weak circadian rhythm. For example, they take night shift and then wake up maybe at afternoon, sometimes afternoon, and then they have to work, and then they go back to sleep around, for example, in early morning, like 6, 7 a.m. So at night, and then when they are off duty, though, at night, they cannot sleep well, for sure. And some people say, hey, I want to sleep around like a 1 a.m. and then wake up like a 12 p.m. So, and then they return to the regular life, and then they cannot sleep well. That makes sense. So when you have this, and then you want to sleep regularly, we are going to recommend just do it yourself, and then slow down, and then you have a regular life reason, and then just go to the bed at the same time, and then when you wake up at the same time, and then you may feel like a refresh, that would be okay. If you want to say, hey, I want to just adjust my life rhythm quickly, you can use a melatonin, less than 10 milligram nightly. That would be very, very good, very, very safe for older people, because our brain just make melatonin. So this kind of things our body just make it. So we just give the reason, like you take a melatonin at 8 p.m., just take it every day. And then your brain will know, okay, about 9, I'm going to sleep. Also, we have other other types of difficulty sleeping. For example, they may associate with a breathing problem. Like I sleep and then I stop breathing while I'm sleeping. So we call it sleep apnea. So if you have this case, you have to see a doctor. And some people may have a movement disorder, for example, like restless leg syndrome. So when people sleep, they just move around. And then for that case, the people need to see a doctor. And also people may have some psychotic thing, like a psychosis, schizophrenia, or very, very severe depression. So you have to see a doctor, and because you may need a medication to control the symptoms. So that's the insomnia. All right, next one. We're going to talk about nutrition. So I just mentioned the ideal BMI will be 27 to 29. I would recommend just try to check your body weight at least once a month, and then write it down, and then you can monitor it. If you have like a body weight change more than 50%, 5% in the past 6 months, you'd better see a doctor, because there's something wrong with you. You just don't feel it, but you can monitor the weight. And then after that, you want to check your body weight weekly and then write it down. Malnutrition. That means your nutrition status is kind of low. You may have much fat, but doesn't mean you don't have malnutrition. So there are multiple factors can cause malnutrition. For example, you may have very low appetite. You don't want to eat. Or you've like a depression. A lot of people with a depression doesn't want to eat. And maybe you have some pain in your mouth and you don't want to chew and you don't want to swallow. Or maybe you have a very small stroke and then you develop a difficulty swallowing and then you don't want to eat. So you lose weight, you lose nutrition, and then you develop malnutrition. And some people may have a digesting problem. For example, like IBD, colitis, chronic diarrhea, chronic nausea, vomiting. So you cannot eat. Once you eat, you just vomit. And also other people may have some metabolic problem, like a hyperthyroidism. Your thyroid gland work very hard and make you consume a lot of nutrition. You eat, but you cannot catch up. So you lose weight, you develop malnutrition. So there's so many risk factors that cause malnutrition. And some people like vitamin, multivitamin, which is maybe okay if you can eat, if you can have a good appetite. But multivitamins is kind of can increase your pill burden and then can lower your appetite. If you lose appetite, you'd better just stop multivitamin and then see a doctor and go from there. And intake, about the protein intake, we will recommend 1.2 to 1.5 gram protein per kilogram body weight. So if your BMI is very high, you can talk to a doctor, because the recommendation will be case by case, but on average, this is how much protein we recommend. And the vitamin D, there will be always recommended. No matter if you are like how old you are, a lot of people has vitamin D deficiency. So we always recommend vitamin D. That's one. The other one, older people may have a high risk for the fall than younger people. So vitamin D, about like 800 units per day to 4,000 units per day may lower the risk for fall. So you can take like a 1,000 or 2,000 units a day, and then later you just check, see your primary care and go from there. And exercise, of course, if you do more exercise, you may have a better appetite, and then your risk for malnutrition will be lower. So that's why we always recommend exercise if you can. And the nutrition supplement, that's the same. If you have a good appetite, you probably don't need a nutrition supplement. But if you feel like you're losing weight and then your appetite was low, and then or you cannot swallow something like that, you may consider the nutrition supplement. But at the same time, some concentrated nutrition supplement may cause diarrhea. So be very careful. When you start a nutrition supplement, you want to talk to a doctor, right? Just make sure this is the right thing you want to do. And the last one, when you see a doctor, we just talk about when you your weight change more than 5% in 6 months, you want to see a doctor and find out why. Next one, constipation. It is very common. It is very common. So how do we define the constipation? What does constipation mean? That means no bowel movement more than 2 days. So the first line treatment is not medication. It's always like oral hydration, try to do more exercise. Like if you drink more water, your bowel movement will be better. If you do more exercise, that may help bowel movement, right? And also regular life breathing. If you want to have a bowel movement every morning, you try to do it every morning. And then your body can feel it. When you have a feeling, you just go there and then you have it. And the high fiber diet, which is very, very useful to prevent or improve constipation. Medication, when you try the first line and the second line treatment, they all don't work. So you want to consider the medication. So the medication, we recommend the suppository because it is safe. Suppository better than oral pill, better than enema. Enema is very strong. Not everyone like it, and then it may cause some electrolyte imbalance. So we want to try the suppository first, doesn't work, and then we try some oral pill and then go from there. Urinary incontinence. It is very common, especially for female. So we have 4+1 subtypes. So the subtypes like overflow, stress, urge, urinary incontinence, and the combined, like a stress, combined, urge, incontinence. And then we have a functional incontinence. So what does the overflow incontinence mean? That means you cannot empty your bladder, right? And then you hold it, and then your bladder become more bigger and bigger, and then suddenly you cannot hold it, and then you just release. So that's overflow. Stress, when your belly pressure increase, and then you leak a little bit urine, that's stress. Urge, that means you want to have it, and you have to go. You cannot wait. You cannot hold it. Just you have to go, and then you just leak. So stress sometimes combined with an urge. And what is a functional? Functional means, for example, the people have a stroke or have a severe knee pain, they cannot walk. So when you feel like I want to have a urination, but I don't have enough time to go to the bathroom. That's functional. So that's like a 5 subtypes urine incontinence. And the treatment plan will be like a symptom-centered treatment. For example, if you feel like overflow, if you diagnose overflow incontinence, we would recommend just go to the toilet more often, right? And you just try. And if you have a functional incontinence, we may have like a bedside commode or something like that. You just make urination easy. But the most important thing is we the better to know if there's urine tract infection or not. So usually urine tract infection, a lot of people cannot feel it, okay? And then when they do the urine test, the test show, hey, there's like an infection marker. So you may have an infection, but a lot of people cannot feel it. So the most common symptoms for urine tract infection will be like a burning sensation when you pee, or you may have a acute urgency of urination, or increased frequency of urination. And then you may see some blood, or maybe when you do the test can show some blood in the urine. So those are signs of a urine tract infection. So if you have it, you just treat it. But most common, the first line treatment for urine tract infection is not antibiotics. You want to just try to drink more water, okay? And then just monitor the symptoms. If the symptoms gone, you don't have to use antibiotics. But next day, if the symptoms still there, you want to take antibiotics to control the infection, okay? So the first line treatment will be hydration, oral hydration, and then second line antibiotics. But for any types of urine incontinence, we want to just think about like a frequent toileting. Why? It is kind of like an exercise. No harm, right? You just go to the toilet every 2 hours, and then you pee there. No matter how much you pee, you just pee there. And then you come back and you just like walk, doing exercise. And then you may have less symptoms of urine incontinence. So we always recommend, if you can walk, you just do that. And for male, the benign prostate hypertrophy is very common. And the most common asked questions, the first one, when should we start medical therapy or surgical therapy? So the medical therapy always go before the surgical therapy. So we have our medications, but when we should start it? When you feel like the problem caused when the problem lower your quality of life, and then you want to take the medications. And when the medication doesn't work, you want to change to another one. If it doesn't work, you want to go to see a surgeon or urologist for like a possible surgical therapy. So that's the order, right? You want to try by yourself, and then you want to monitor the symptoms, and then you want to try the medication, and then you want to consider surgery. The next question will be, should I test a PSA? Should I do like a prostate cancer screening test? The test is not recommended because, if you ask, the doctor will order it, but the doctor not very few doctors just recommend it unless you have some symptoms or some like a red flag. For example, you lose weight and then you feel like you have symptoms of prostate hypertrophy, and then the doctor may order it. If you don't have those things, you don't have to check the PSA. You just monitor it, monitor the symptom, and go from there. All right, so take home message. So we spend about like 35 minutes or 40 minutes to talk about how we can how the older people can remain healthy, and there's some tips and there's some recommendations. So the major thing is the balanced diet and the regular exercise are very, very highly recommended. for everyone. The second one is actively engage social life and entertainment. So try to talk to the people, try to engage the activities, and try to have fun, try to play the game, play with your kids, your grandkids. Very, very good. Very good for your brain and very good for your function. And last one, all medical treatment should be highly individualized, given your medical history, your age, your functional status, and the support. So if you are older than 65, if you have some medical issue, you do want to talk to a doctor and make a plan, because the different people may have a different treatment plan. That's geriatrics. So thank you very much for your attention, and happy to take any questions.
I see one question here in chat, a couple questions from
Yeah,
William.
sure.
Can you take melatonin 5 milligrams every night? Will it cause your body, well, it says here, will it cause your body to produce melatonin? But I think they probably mean, will it affect your body's production of melatonin?
Less than 10 milligrams should be fine. Usually we start from low dose, like 1 or maybe 3 milligrams per night. And then if you start it, you want to take it at the same time every night, and then they may work. So there's no side effect reported to like lower the melatonin you produce. So no worry about that.
Okay, and thank you. And another question from William. Besides vitamin D, should we take calcium?
Yeah, sure. This is a very good question. So usually, vitamin D go with the calcium, right? So it's like over the counter. So I would recommend if your kidney function is okay and you take vitamin D or calcium, doesn't matter. If your vitamin D was very low, you probably need to take actual vitamin D supplement in addition to vitamin D plus calcium. So it's okay. So take both at the same time. It's all right.
Okay, so here's another question from Alan. Could you give some suggestions about how to gain weight?
Yeah,
You might,
sure.
okay. Well, I was
Yeah,
going
yeah,
to, yeah.
yeah.
Okay.
Go ahead, Steven. Sorry about that.
No, it's okay. I was going to ask Alan, you might want to be more specific. Is there a reason why you want to gain weight or?
Yeah, yes, that's what I want to say too. So generally speaking, unless your BMI less than like a 20 or 18, you don't need to gain weight. Oh, okay. So if your BMI is very low, you want to gain weight. The first one, you want to check why your body weight was low, BMI was low. For example, you want to check a thyroid function test, and also you want to check if you have other health conditions. For example, like a GI problem, like a colitis or some like stomach issue, like ulcers in your stomach or something digesting issue, something like that. After that, you want to check the cancer. You want to rule out the cancer, right? And if you rule out all of them, and then you still have a very low body weight, very low BMI, you may eat like high protein, high calorie ensure or nutrition supplement, and then you calculate. So based on your body weight, how much calorie you need a day, and then how many pounds you need to gain, and then you can calculate. So 3,500 calorie equals to 1 pound of body weight. So you can count, but I would recommend try to find out why your body weight was low. Hyperthyroidism. Hyper. Let me type here.
All right,
All right.
thank
I
you.
think we have some questions you collected, right?
Yes. So actually, there's another question here. Do you
How
want to
to
address
low?
this one first? Yeah.
Yeah, sure. Yeah, how to lower low cholesterol. Um, can you clarify again? That means the cholesterol level was low, and then how to lower the low cholesterol, or the cholesterol level was high, you want to lower it. So here's the thing, general speaking, how to lower cholesterol. So I would recommend like a low fat, low cholesterol diet. That means basically vegetable and the fruit may take um, more percent than euro. And low, okay, LDL, yes. So yeah, so just eat less meat, less egg, and then try to eat more vegetable and fruit. And this is the diet modification for high cholesterol level. And also you need to take the medication like statin. I write that down here. Like and blah blah this. Yeah. So try the diet modification first, and then if doesn't work, you may need to try the medication. That's the principle of the geriatrics.
All right. So yes, we did have a few questions from the registration sheet. So the first one here we have is how can we prevent hearing loss?
Yeah, so that's perfect question. So usually we have to know why the people have a hearing loss, right? Is from occupational exposure or from a stroke or from other things. So injury from some accident. So if you have nothing about that, like no stroke, no occupational exposures, and then you may have like a hearing loss. The major thing we can do is just try to, how to say that, how try to don't speak aloud, all right? And then try to avoid using like earphones, something like that. And then don't go to the very loud environment. So just save your ear, and that's the thing. And then if you have a stroke, that will be a different story. So we have to, sometimes when people have a stroke and then they don't go to the hospital on time, within like 3 hours, usually they may have a chronic damage. So when nerve damage, they will be gone. So we cannot just fix. But when the people have a hearing loss, we recommend like a hearing aid. So it will be case by case. You'd better see a doctor to evaluate how much hearing loss or what kind of a hearing loss you have. Or maybe it is like a conduct hearing loss, or maybe this is like a sensory hearing loss. So the treatment will be different. But if you need a hearing aids, that will be very, very individualized. They have to check and then give you the hearing aid.
Okay, so this isn't a question, but it's a follow-up question for hearing loss. It's another part. So is there a way we can prevent or help with tinnitus or ringing in the ears?
Mm, if this is due to the aging, it's very hard to prevent. But if there's another like medical issue, we can just see either ENT or your primary care, and then we can find out what kind of issue you may have. And I know there's someone just have a tinnitus for a long time, and then we did MRI, we did a CAT scan, we refer to the ENT, but there's no reason, right? So if this is the case, I would recommend just see a neurologist, just double check. And
Okay.
also, yeah, and also some neuropathy may cause that. For example, if you have a diabetes or if you have a car accident, damage your nerve, you may feel it. And also you have a vitamin B12 deficiency, you may feel it. So it's hard to say now, but yeah, the better just see a doctor to find out why you have a tinnitus.
Okay. Thank you. So our next question is there anything we can do with or to help with muscle weakness and joint pain?
Yeah, sure. That's a very good question. So the muscle weakness may happen to everyone when people is getting old. This is part of like an aging, very common, very normal. And unless you have a stroke, right? Kind of like a weak muscle weakness on one side, then you'd better see a doctor. You don't want to wait. So there's a window, 3 to 4.5 hours. If you have a stroke, you find out you have some like a sensation change on one side or muscle weakness on one side, you go to the hospital as soon as possible, and then the treatment can be given within 3 hours. 90% you may recover and return to the baseline, which is very good. So this is a window you have to remember. But if you have a chronic muscle weakness and then you don't lose weight, okay, so you want to do exercise. So like a physical therapy, occupational therapy. You just keep doing that. Try your best. You may regain the function, you may regain the muscle strength, but it really takes time, depends on your age. So I would recommend if you have a like bilateral muscle weakness for a long time, you just do exercise and every day, and then uh, once a week you want to I mean you want to do a little bit more than the previous week. So just do progress every week, and then you want to do exercise every day, and then you go from there. Knee pain, another common issue. So usually the most common cause for knee pain is like osteoarthritis or rheumatoid arthritis. And but osteoarthritis is more common than rheumatoid arthritis. So osteoarthritis caused by uh, I can say overuse of your knee, or when the people kind of aging, so everyone when you were just like turn 80, 90s, everyone has osteoarthritis. So that's very common. So for knee pain, you want to control the pain first, right? You want to use the patch, or you want to use like a topical cream for the pain control, and then you want to keep your function. So you want to use some like a walker cane to make sure you don't fall, and then you walk. Okay, you walk 10 minutes today. Next week you try to walk 15 minutes. Next week you do like a 20 minutes. You just keep your function, and then you control the pain, keep your function. If you have a rheumatoid arthritis, you'd better see a doctor. And also we have like a steroid injection, and then it can control the pain for about 3 months to 6 months, which is very common. So you can consider that. You can talk to your primary care, or you can talk to um, orthopedic surgeon to get it. So the major principle is you control the symptom, you keep walking, and then be careful, don't fall.
All right, thank you. So there is one more question. Are you able to see the Q&A? It's a great question.
Uh, there's any way to treat hand arthritis? Oh yeah. So for I think it should be like a teamwork. So as a geriatrician, I will control the pain first, and then we need uh we need a what do I say, like a PMR doctor, like or we need occupational therapy, and then we need a rheumatoid arthritis. No, not rheumatologist. Sorry about that. So it should be a teamwork. So control the symptom and then do more exercise and follow up with a rheumatologist. Sorry.
So there's actually one more question. It's in the Q&A. Are you able to open up the Q&A? If not, I can read the question.
Yeah, please. I
Okay,
did not
sure.
see it.
Okay, that's okay. So the question is, a lot of my friends and I are having some symptoms of forgetfulness, such as short-term memory loss. It seems very common to us getting old. Any suggestion about the right timing to check out with the doctor on the possibility of dementia?
Thank you for asking. Yeah, in this presentation, I did not talk about dementia, but it is very common. So the first one, memory loss. Everyone has memory loss since they're 10 years old. Okay, so it is very common. When should we see a doctor? So if you have impaired quality of life, okay. For example, you forgot to take medications very frequently. You forgot to see a doctor. You forgot where you are, and you just like you forgot where to go, something like that. You'd better see a doctor. So how to diagnose a dementia? First one, we need to do the test, right? We need to evaluate your cognition. We have a SLAM test. We have a MoCA test. We test your memory. We test your brain functions, and then we need image study. We need blood work to rule out like anemia. We rule out depression, rule out the B12 deficiency, and rule out electrolyte imbalance. After that, we can diagnose, and also you need have at least one dependent activity of daily living. For example, you cannot cook, you cannot change dressing, you cannot change clothes, you cannot take a shower, you don't know how to call the friends, something like that. You have to have at least one impaired activity of daily living, plus cognition impairment, plus evidence of like a dementia under the image study, and you don't have other medical issue, and then we can diagnose dementia. When you are diagnosed with dementia, there will be like the package for you and for your family. We have a family support program. We have a dementia respite care. We have a home health care. And then we have to see a doctor, try to set up all the care. And then we monitor you every 6 months, okay? And then, so that would be very complicated. We need a team to take care of you and your family. So, so that's kind of for dementia. Did I answer the question? So I see next question. How many different kind of, oh, thank you. How many different kind of a vitamin taken daily is considered too many? So here's the thing, if you have a good function and then you don't have a low appetite, you can take anything like vitamin D, vitamin B, vitamin A, vitamin C, right? But you'd better consider the vitamin is kind of a pill, right? They may increase the burden for you, for your body. So if you have a low, I should say, low function of a liver, low function of a kidney, you should be very careful about any medication you're taking, even any vitamin you're taking, because they increase the burden for your body. And then when your body is getting old, as part of aging, your liver function will be lower, your kidney function will be lower, your heart function will be lower, your GI function will be lower. So be very careful. Just monitor the symptoms. Monitor how you're feeling every day. If you feel weird, you feel like weaker than like before, you'd better just stop it and then see a doctor. best fasting glucose level. So that would be like, as I remember, 80 to 100. But
Okay.
we don't recommend for all people. It depends on your age. For example, you're like age 90, 70s, right? Your blood sugar is even more than 100, 140, 200 is okay, which is acceptable. Because low sugar is more dangerous than high sugar for older people.
So our time is almost up. We have one more question, and if you would like, you could stay on. Up to you, Dr. Leo, if you would like to answer more questions.
Sure, yeah, sure.
Okay. But we have one more question from the registration list. It is, what foods can we take to boost our immune system?
Usually the high protein foods can boost the immunity system. And there's one food, as I remember, is mushroom. But there's no evidence, to be honest. There's no evidence. We just people talk to the people about that. But I don't recommend anything like that. So, so immune system, if you have like a malnutrition, you try to have like a high protein food. That's only one thing I can say.
Okay, that's good to know. How about, so this is my question, but how about
Yeah.
antioxidant foods? Does that play a part with the immune system?
Can you say that again? Antioxidant?
Yes, antioxidants. I think.
Oh,
Yeah.
so yes or no? For example, like a vitamin C, right? It works as like a antioxidant, but they don't increase immunity system. So the answer is yes or no.
Okay, I know it. I know
Yeah,
it's. Yeah.
we don't have evidence to say that. So
God, I know a lot of things that you read online are saying, oh, antioxidants are good for you, or things like
yeah, they're
vitamin
good
C.
for you. Yeah, that's good for
Mhm.
you, but maybe cannot boost your immunity system.
Got it. Okay.
Yeah.
All right. Thank you so much. I learned a lot today. I think it's about time. Do we have any final last questions before we call it a night? Give it about a few seconds.
Sure.
All right. Thank you so much, Dr. Leo.
Yeah.
It was
Thank you for
great.
your time. Yes. Thank
Oh, it
you
was
for
our
everyone.
pleasure. All right. Thank you, everyone, for joining us tonight. I hope you all learned a lot.
Yeah. Sure.
All right.
Yeah. So have a good night, everyone.
Actually, we have one final question here.
Yeah. Sure. Sure.
How many eggs can we eat per day?
So let me count. 1.5 gram per kilo, per kilogram. So if your body weight is like a 50, right? So that would be 75 gram protein that you need for one day. And then one egg is about 40 to 50 gram. And then you ate one egg and then you ate something else and then you're good to go. So that means one egg per day is perfect.
So about one egg is the limit. Well, I think they might be asking about the cholesterol in eggs.
So yeah, so if you feel like you have a high cholesterol level, you don't you just eat the white part, okay? Don't eat the yellow part. And then you can eat like a white part for 2 eggs.
All right. Thank you again. I hope everyone enjoyed Dr. Leo's presentation. And we are recording it, so we will post it online if in case anyone missed anything, okay?
Okay.
All right,
Good.
thank you.
All right. Thank you.
All
Thank
right,
you,
bye-bye.
everyone.
Thank you.
Yeah. Have a good night.
Good night.
Bye.